I am committed.
I'm committed.
I'm committed.
We are committed.
I am committed.
I am committed.
We are committed.
We are committed.
I am committed to supporting community because we need community voices as well as community perspective at the table in order to really end HIV.
I've been doing research at Gilead for 25 years, and I'm committed to trying to find HIV cure. This is one of the biggest challenges of HIV research, and I believe we need to keep trying for the sake of 36 million people living with HIV worldwide.
We are committed to the inclusion of women, particularly those who've been historically underrepresented, in HIV prevention.
I'm committed to helping people at risk for HIV overcome stigma.
I'm committed to HIV cure research. Here at Gilead, we are working on developing combination therapies, both internally and through external collaborations, to target the HIV reservoir, as well as enhance the immune system's response to HIV.
I'm committed to medical education. As a former HIV care provider, that was my second most important priority after patient care. Now at Gilead, I'm able to maintain my relationships with providers around the world and continue educating them about HIV treatment and prevention.
To enhance the voice of the community in our clinical trials.
I've been working in HIV for more than 20 years, and now more than ever, I continue to commit to listening to diverse voices from the community, from healthcare providers, and from researchers, so we can partner together to fight HIV.
I've worked together with non-governmental organisations who work tirelessly to reach remote and underserved communities to access treatment and care, and I am committed to
This is a tale of the courage, determination, and resilience of remarkable people in 6 cities around the globe, and the progress of the groundbreaking FastTrack Cities initiative, led by IAPAC and UNAIDS. This film is about progress. Working with IAPAC and Gilead Sciences, we highlight the unique challenges, barriers, and successes faced daily in the FastTrack cities of Atlanta, Kiev, Nairobi, London, Bangkok, and Sao Paulo on their journey to attaining the UNAIDS 1990 targets, then getting to 0 new HIV infections and 0 AIDS-related deaths. Representatives from key populations, including transgender women, men who have sex with men, people of colour, women and girls, people who inject drugs, and sex workers, all of whom have faced stigma and discrimination, share their stories as they act locally to ensure no one is forgotten or left behind in our global efforts to end the HIV epidemic by 2030.
The FastTrack Cities initiative was launched on World AIDS Day 2014 by 4 core partners, including UNAIDS, UN Habitat, the City of Paris, and IAPAC. And our engagement with the initiative is to assist cities and municipalities around the world to attain the 90-90-90 targets that were set by the UN in 2014. 90-90-90 translates into 90% of people living with HIV/AIDS knowing their status, 90% of those people who know their status on antiretroviral therapy, and 90% of people who are on antiretroviral therapy achieving viral suppression. Largely because of urbanization trends, by 2050, 6 of every 10 people will live in cities or municipalities.
We've seen the HIV epidemic go from being a near certain death sentence to, for many people, being a manageable chronic disease. Yet in some places we see true disparities.
Many cities and municipalities had drafted city AIDS plans decades ago that had collected dust on shelves for quite a number of years. So the 90-90-90 targets and the FastTrack Cities initiative specifically has served as a catalyst for getting those plans dusted off, updated, and focused on programmatic targets that allow for the accountability that communities expect.
6 cities, 5 continents, 1 goal: ending HIV.
We also need to ensure, though, that we leave no one behind as we try to get more people diagnosed, onto treatment, and virally suppressed. And as important, we need to make people aware of the variety of HIV prevention activities or tools that we have at our disposal to stop the acquisition of HIV. Those elements together are what I call the calculus for success in ending an epidemic. What I'm excited about is that, at least at urban level, the political will, the public health leadership, the financing, and the engagement, active engagement of communities affected by HIV is very much present. And so if I look at ending AIDS as a public health threat by 2030 within urban centers, I'm extremely hopeful.
The way we see it, the impossible
is not impossible.
The impossible is simply what hasn't been achieved yet.
So we pursue it.
We chase it down.
We tackle it for answers.
We surround it for a way in.
This is how every once impossible breakthrough has ever been created.
A revolutionary approach to cancer therapy.
A path to a cure for HIV.
A cure for hepatitis C.
A better, healthier world for every person to live in.
None of this is impossible now because of the people you work with.
The communities we stand with.
And the partners we push forward with.
Together, we've created what's possible through science,
grit,
compassion,
and courage.
And we will do it again.
No matter what.
No matter the stakes.
No matter who says we can't.
When faced with the impossible, we don't falter.
We band together, and we prove it wrong.
The impossible
is not impossible.
It's what's next.
C'est notre futur.
우리가 다음에 해야 할 일입니다.
خدم بعدیه.
ano ang susunod.
Es lo que sigue.
呢個就係我哋嘅下一步。
It's what's next.